Hi, my name's Catherine Schaff, and I'm a Mission resident. I have a doctorate of public health from UC Berkeley, and we're speaking on behalf of the Public Health Justice Collective, which is a network of more than 500 public health advocates in the Bay Area. We oppose SB 1045 and urge you to do the same, and instead invest in public and mental health supports, including voluntary servicers. We're particularly concerned with three specific areas of negative public health impacts of SB 1045. The first is there'll be immediate harms to those put into conservatorship, including disruption of social networks, loss of property, and increased interactions with police, which increases the likelihood of being exposed to police violence. While sweeping people under the rug may placate rich corporations, it doesn't do anything to help or heal the people of San Francisco or put us on a path to addressing the rampant inequality in our city and the lack of housing, jobs, and services. A more effective solution is having the corporations actually pay their fair share of taxes. The second concern is the attack on civil liberties, which weakens our democracy. Strong democracies where there is a baseline of civil and human rights are healthier places for all of us. SB 1045 moves our framework for treating mental health concerns further under the purview and discretion of police, which is directly counter to public health research and recommendations. The American Public Health Association passed a resolution that shows that people who face mental health issues are already more likely to be exposed to police violence. And San Francisco's own Health Commission recently passed a resolution with sound evidence for approaches to these issues as health issues.
Hi, my name is Amber Akemi-Pyatt. I'm also part of the Public Health Justice Collective. So building on what Dr. Schaff was just saying, San Francisco's own Health Commission, as you all know, recently passed a resolution with sound evidence for approaches to these issues as health issues, rather than disproportionately harming people by relying on police and prisons or developing systems that are more prison-like. It sets a dangerous precedent when we should be investing in other solutions. The third public health concern we want to bring up is how this proposed legislation and the implementation of it others people. The Bay Area is at the forefront of research on the negative impacts, including health impacts, of othering people. Yet this proposed legislation and its implementation would put us on the forefront of dehumanizing people. By othering, we mean the process by which we use messages and laws to create a mythology that some of our residents are different, less than human, not deserving of basic freedoms and rights. And this process of othering is how some of the greatest atrocities of humanity have succeeded, whether it's tearing children from their parents at the border or making people who are unhoused disappear and their fate subject to the whims of the elite of San Francisco. The rhetorical process of othering is the same, and the public health implications are severe. We should be ashamed of this from a moral standpoint. And from a public health standpoint, we know that this othering, this telling people in many different ways that they don't belong, also harms their health and the health of our greater society. We cannot and will not have healthy communities and a healthy San Francisco when we are so readily willing to discard part of our community. We therefore oppose the implementation of SB 1045 and urge you to do the same. Thank you very much.